We take a look at the Ashanti region, where Director of Ghana Adventist Health Services, Dr. Paul Amotreme, has confirmed that the medical director of the Kwadaso SDA Hospital has died of COVID-19, but with underlying health conditions. The 48-year-old Dr. Harry Usubuating was found dead in his room on June 13, 2020, few days after he was complaining of being unwell.
It is true that the medical director or medical superintendent at Kwadaso SDA Hospital in Kumasi has passed away on the 13th June 2020 in the morning hours. And when the matter or the news was reported to us, a team was dispatched to take a sample to test, to establish what might have led to the demise. And when the results came, it was established that it was due to COVID-19, yet with underlying health or medical conditions. By the grace of God, our workers, they are stable. We've met them, we've spoken to them, and we've strengthened them. We've also fumigated the hospital, and now work is ongoing. Everything is under control.
It's obviously a difficult situation. Dr. Amotreme may also reveal that 200 workers of the hospital are undergoing COVID-19 tests, which means they have to be isolated.
We should be rest assured that our workers, they are stable, everything is under control. For this reason, there is a need for us to test them, for them to know their status. Because the doctor was working in the hospital, he was doing ward rounds with some of the workers, and being the medical director, he was chairing a lot of meetings. So we strongly believe that some of our workers may be at risk, and for them to be on the safer side, it will be more expedient to test them all. So we've tested them, yeah. And we are waiting for the results. We trust in no time the results will be out. And when the results are in, then it will also help us to know the further action which we will take.
Ohim Interior is joining us live from the area with more of what we ought to know. 200 workers, health workers, having to be isolated. Certainly, we are looking at impact on healthcare delivery there. But some of your messages before we go to Ohim Interior. This message is from Richard T. He's sending it from Tamale. It's rather a long one. I'll try and read some. It says, as a matter of fact, as much as we commend the government for what they have done so far in this fight, I must emphatically state that our best is not really the best. We're still painting a picture that everything is under control. Meanwhile, we're just at the verge of being overwhelmed by this pandemic. I don't understand, he says, why we keep emphasizing that our death rate is low and recovery rate is high, and for that matter, we're doing better. Besides God being our side, we should know that the low death and high recovery rates may be hinged on the fact that our health facilities and caregivers are not overwhelmed yet. But we're almost getting there, you say. We'll talk to Ohim Interior and find out what the sense of whether or not the people feel this sense of overwhelming state of this pandemic. He says we just have to take a cue from what is happening in countries like Italy, Spain, the US, and take pragmatic measures on that. Let's go to Ohim Interior right now, who is joining us from the Ashanti region. Ohim.
Good to you.
Right. Give us an update on these 200 workers who have to undergo the COVID-19 test. What do we know? What more do we know about them?
Yes, Gifty, the 200 workers are from Kwadaso SDA Hospital in Kumasi. The Ghana Adventist Health Services believe that some of the workers, some who were close to the doctor and worked with him on routine medical and ward rounds, could be at risk of COVID-19. So that is why they are collaborating with the Regional Health Directorate and the Kwadaso Municipal Health Directorate to test the over 200 workers who works at the Kwadaso SDA Hospital in Kumasi, Gifty.
And so they may have come into contact with this doctor who has died. As they are waiting for their results, I mean, this is 200 people. These are 200 people. Does it mean that there will be fewer people working at the hospital, or will it be closed altogether?
That is what I sought to understand from the hospital management, but the indication I get is that these over 200 health workers who are believed to have come into contact with a doctor, they are not at post as we speak. At the time that I went to the hospital to speak to the hospital authorities and then the Ghana Adventist Health authorities, I realized though their samples were being taken, the hospital was still running with some hospital staff still at post giving and attending to the health needs of the general public. So yes, I would say the Kwadaso SDA Hospital has not been closed down. Okay. It is still working, and according to management, even the number of patients who used to patronize the facility before the medical director died of COVID-19 has not gone down. They are rather seeing an increase in the number of patients who patronize the Kwadaso SDA hospital services.
I mean, let's talk about this medical director. What more do we know about him? We understand from what you've said so far that he complained of ill health the previous day, and the next thing he was found dead in his room. Really disturbing. Tell us more. What do we know about him and the situation that led to his death?
Well, what we do know about Dr. Harry Owusu-Boateng is that he joined the Kwadaso SDA Hospital in 2013, about 7 years ago, working as a physician, and in the process rose to the rank of the medical director. Since then, he has not left his post as a physician at the facility. He continued to serve the hospital in various capacities, especially attending to people in consulting rooms. So even at the time that he complained of ill health, the last time he reported for work was on Thursday, and he complained of ill health. And according to the hospital authorities, he was asked to go home and take a rest. So he went home on Thursday, but did not return to work on Friday, only to hear that he has passed on the Saturday morning. So when management heard the news, then they arranged for test with the support of the Kwadaso Health Directorate and the Regional Health Directorate for further tests to be done on him. And that is when it was confirmed that indeed he died of COVID-19, but with underlying health conditions that may have aggravated his condition, Gifty.
This is a very sad situation. Indeed, it saddens my heart to hear this story. But do we know from where he got this? He got the disease?
For now, it's too early, according to hospital sources, to be talking about where he got the condition. But when I spoke to the clinical coordinator, Dr. Randolph Ba-Edu, he did indicate that this is not the first time the hospital is recording COVID-19 case at the facility as far as health workers are concerned. But Dr. Harry Owusu-Boateng becomes the first casualty health worker to have died at the facility from COVID-19. And he says because management is so concerned with the life of health workers there, they have been conducting tests for staff every 2 weeks. So in every 2 weeks, they have COVID-19 tests for all medical staff at the facility. So for now, it's a bit surprise to hear that Dr. Harry Owusu-Boateng, the medical superintendent, has died of COVID-19. As we speak now, they've not been able to establish where he contracted the condition from, whether at a facility or probably outside the hospital. It is still unknown, Gifty.
I'm sure that they will be conducting more tests so that we can understand what happened. Bahimi, do we know anything about his family? Does he have children? What more do we know?
That information has not been put out, but what I learned is that the late Dr. Harry Owusu-Boateng, his parents are also working in the same medical field. His mother, I learned, is somebody who works as a maternal health officer, and then the father is also a medical officer. but a lot of information on him is a bit sketchy. But this is the information that we do know about him. And then we also we are told that at the time of his death, he was living with his security man at his residence.
Ohimhen, thank you. May his soul rest in peace. As it is now, information is still trickling in, and so we'll take it slow and we'll take it one at a time as and when it comes. Ohimhen, thank you very much for that update.